Well, personalized medicine is a new technology. It's the development of a new technology in therapeutics and in diagnostics. And it is an advance on medicines based on scientific discovery over very recent years. The direction is on systems analysis more than on symptoms analysis, and it is using the detailed information of the patient himself or herself, particularly the genetic makeup of the patient, so as to identify what drugs might be suitable to be administered to the patient to cure the disease that's complained of. Personalized medicine is more focused on the genetic makeup of the patient. So patients fall into a stratification based on their diagnostic makeup, and they fall into a very small group of people, but the drug that's available for them targets that particular condition for those particular patients and is very effective to continue their lives longer. They live longer as a consequence of taking that drug. But if the patients don't have that genetic makeup, that particular drug will really be of no value to them. So that's what personalized medicine is about. It's not personalized to an individual patient, but rather a stratification of patients who fall into that genetic makeup. The regulatory bodies, those international agencies that authorize the drugs going on the market for the benefit of patients, they are working hard to ensure that the proper standards are in place to enable the discoveries made by scientists to be made available to patients, so that there's a lot of concentration on that in the short term. In the medium to long term, then of course we look to the further development of science so that we can learn more for the benefit of patients over time. Well, the European Alliance for Personalized Medicine was formed 5 years ago with the objective of making this new technology better known to patients, better known to the medical profession, and also to ensure that the legal regime, the regulation of personalized medicine is consistent with the benefits that that medicine can provide for the patient. So we put in place anonymizing procedures to ensure that the patient's privacy is protected, but yet at the same time it allows for the transmission of information. That's just one example, and there are other examples, and we watch that very carefully, and we're in constant communication with the regulators, with the lawmakers, particularly in Brussels, to make sure that a good legal regime is in place for the benefit of this new technology. Well, this is the second year we have this TEACH program. And we started it last year because we believe that the medical profession needs to be sensitized, not just to the science of all of this, but to the transmission of this technology and these new drugs for the benefit of patients. And not in all member states is this the case. So we decided that we would establish this summer school, particularly for the benefit of young healthcare professionals, and we have 80 young professionals here in Romania for this week, and they will become the pioneers when they go back to their own countries for the benefit of the patients living in their countries. So that's what we're seeking to do, and we're committed to doing this in the future, and have secured sponsorship to ensure that this job is done and done well, all for the benefit of the profession, but also ultimately for the benefit of the patient.